Good morning, good afternoon, and good evening from the Prasanna School of Public Health at the Manipal Academy of Higher Education, India. Welcome to everyone who has joined this webinar series. As you may know, we had the first edition of the Professor Rajani Prasanna Endowment Lecture Series, which was completed successfully, and a book was published called On Governance and Challenges from that edition. This is the second edition of the lecture series, and today is the third lecture series within the second edition. And we are going to have two eminent personalities speaking on this. And even more eminent is our moderator, Dr. Vikas Kapil. So we'll have Dr. Vikas Kapil, Dr. Mala Rao, and Dr. Nitya Khemka today for the session. From the School of Public Health, we are very happy to inform that Dr. Vikas Kapil is now our international faculty. A brief introduction to Dr. Vikas Kapil, who will be the moderator of the session. Dr. Kapil served as the Chief Medical Officer and Associate Director for Science at the Center for Global Health at the U.S. Centers for Disease Control and Prevention in Atlanta, Georgia, from 2014 to 2024. In this role, he was responsible for oversight science, quality, scientific integrity and ethics, and extramural research programs for global public health activities for CDC's Global Health Center, including our 60 country offices around the world. Previously at CDC, he served as the Associate Director for Science and the Acting Deputy Director for CDC's National Center for Environmental Health and Agency for Toxic Substances and Disease Registry, and the Associate Director for the Division of Injury Response in the National Center for Injury Prevention and Control. Professor Kapil attended the medical school at Michigan State University and received a Master of Public Health from the University of Michigan. He also completed his residency training in emergency medicine, Michigan, and in occupational and environmental medicine at the University of Michigan Medical Center in Ann Arbor, Michigan. Prior to joining CDC, Dr. Kapil served as the Director of the Department of Occupational Medicine at St. Luke's Hospital in Toledo, Ohio, and Associate Senior Vice President for Occupational Health at University of Cincinnati Medical Center. He is board certified in emergency medicine and in occupational and environmental medicine. Dr. Kapil is licensed to practice medicine in Georgia. His primary areas of research and clinical interest include environmental and occupational lung disease, environmental toxicology, climate change and health, preparedness and response for mass casualty events, and health system improvement in low and middle income countries. So I think there can be no better person to moderate this session and to lead the discussion following that today. So without much ado, let me pass over to Dr. Vikas Kapil to moderate today's session. Thank you, and over to Dr. Kapil.
Thank you so much, Dr. Cherian, for the kind introduction. And it's really my pleasure to be here today with all of you. I want to thank you and also thank Dr. Rahul for all the work you've done in getting this session organized, and for inviting me back to moderate for this really exciting presentations today. We have two really illustrious, eminent speakers and presenters, and it will be my pleasure to introduce them as part of the Professor Rajani Prasanna Endowment Climate Change Lecture Series for this year, for 2025. So I have the distinct privilege of introducing our two speakers, Professor Mala Rao and Dr. Khemka, which I will do just in a moment. And then following their presentations, we will moderate the Q&A session. I will be moderating the Q&A sessions. And we will do that after both speakers have completed their remarks. I think we should have hopefully 10 or 12 minutes at the end of their presentations for remarks. So without further delay, let me begin with the introductions. Professor Mala Rao is the Director of the Ethnicity and Health Unit and Senior Clinical Fellow at the Imperial College London. She's also chair of WHO Southeast Asia Region's Expert Group on Environmental Determinants of Climate Change and Health, clinical advisor to the UK General Medical Council on Equality, Diversity and Inclusion, and vice chair of WaterAid UK. She's trained in public health medicine, and her career spans public health practice, policy, research, and training, and has included serving as the head of public health workforce for England, and as the inaugural director of Public Health Foundation of India's first Institute of Public Health. Her most impactful achievements have been in workforce development, strengthening health systems, and environmental health in the UK and in the global arena. She's a recognized champion of climate action, safe water and sanitation, gender equity, and is also globally respected for her advocacy of race equality and research on the interaction between race, health, and climate. She's published many papers, editorials, and book chapters, and contributed to government reports on climate change and health. She co-edited the 2009 Health Practitioner's Guide to Climate Change, described as a wake-up call for health professionals, and guest edited the 2022 issue of the International Review of Psychiatry, focusing on the climate crisis and mental health, an often neglected area, as you all know. In 2010, she led the writing of the chapter on human health in Government of India's led assessment of the impacts of climate change and WHO's review of the health of the urban poor in Southeast Asia. She's been included in the most influential ethnic minority people in the English health world and is the recipient of many awards, including an OBE in 2013 and CBE in 2024. The UK Faculty of Public Health's Alwyn Smith Prize in 2021, and honorary fellowship of the Royal College of Pediatrics and Child Health in 2022. That is Professor Rao's introduction, really an eminent personality in this field. And then second, I want to introduce our second speaker, Dr. Nitya Mohan Khemka. Dr. Khemka is a public health specialist and academic professional. She is currently trustee at the Nandanjeet Khemka Foundation and the Nabha Foundation, focused on the conjunction and interface between climate change and public health. She's also a director at PATH, which is a global think tank dedicated to improving health equity, an organization we at CDC have worked with very closely over many years. Nitya holds a PhD and MPhil in development studies from the Department of Land Economy at Cambridge University, where she studied health and gender, focusing on the decentralization of the health sector in 2 Indian states. She serves on the Women's Leadership Board of the Harvard Kennedy School of Government, is a trustee of the Eisenhower Fellowships, Associate Fellow at the Homerton College, a visiting fellow at Observer Research Foundation, and on the United Nations High Commissioner for Refugees, UNHCR UK Advisory Board. She served as co-chair on the health and gender tracks for T20, the official academic and policy track for the G20 under India's presidency. Dr. Khemka has published widely on a range of topics in human development, climate change, public health, philanthropy, and gender. So without further ado, let's move. As you can see, we have 2 remarkable individuals presenting today. So let's move to the first presentation from Dr. Mala Rao. And then we'll have a brief transition and hear the remarks from Dr. Khemka. And then at that time, we will open it up for some questions and answers, hopefully from both of our speakers.
Chair, Dr. Vikas Kapil, and Dr. Cherian, Dr. Session Clare, Nitya, and esteemed colleagues and friends, I am deeply honored to be invited to contribute to the Professor Rajani Prasanna Endowment Lecture Series and to share some perspectives from my role as chair of WHO Southeast Asia Region's Expert Group on the Environmental Determinants of Climate Change and Health, and from my own research, writings, and advocacy on climate and health starting in the 1990s, when I first became aware of the growing severity of the climate crisis and its impacts on human health. My plan for this lecture is to share some observations on climate change and health in the global arena, the particular challenges faced in the Southeast Asia region as well as across the world, the opportunities for climate mitigation and adaptation, and what Prasanna, School of Public Health, could do to contribute to policy and action. But before I begin, I'd like to acknowledge the many colleagues, scientists, and organizations whose work and research are cited in my talk. We are in a climate emergency, with signs of climate breakdown literally everywhere. You may have read about the devastating floods and landslides triggered by Typhoon Yagi, which affected Thailand, Vietnam, Philippines, China, Laos, and Macau in September last year. It was reported by UNICEF that 6 million children and their families were affected, and that access to clean water, education, healthcare, food, and shelter were severely compromised, pushing already marginalized communities deeper into crisis. Now, last August, flash floods in Bangladesh, triggered by heavy rainfall and upstream water flows from India, ravaged areas right across the eastern regions of the country, affecting millions of people, isolating whole communities cut off by the flooding and displacing others evacuated to temporary shelters. And the damage in terms of infrastructure, agriculture, livelihoods and homes amounted to millions of dollars. And then the severest and longest heat wave recorded in India happened last year in May. Many of you will have experienced it, with 24 consecutive days of temperatures above 40 degrees, and some parts of India recording temperatures up to 50 degrees centigrade. Other parts of the world have been just as severely affected last year, from Hurricane Beryl, the extremely dangerous Category 4 storm, which had devastating impacts across many parts of the Caribbean, to the rain and floods on a scale never witnessed previously, which left 580,000 people displaced in one region of southern Brazil in May, the catastrophic floods in Spain and Valencia and its surrounding villages and towns in October, and of course the wildfires, which are devastating parts of Los Angeles even as we speak, putting even the iconic signs and landmarks of Hollywood at risk. Climate events are occurring at greater frequency, intensity, and severity in every region of the world. And the explanation for these catastrophic events is clear. Sunday, 21st of July, may have been the hottest day ever logged by scientists, when the average surface air temperature hit 17.09 degrees C. More notable is a key observation of the Copernicus Climate Change Service of the European Union, which provides authoritative global climate data. They noted a big difference between the temperatures of the last 13 months and previous temperature records, leading to the director of the service stating that we are now in uncharted territory and new records are likely to be set in future months and years. And they were right, because their most recent update is that 2024 was the warmest year on record and the first to exceed 1.5 degrees C above pre-industrial levels for the annual global average temperature. Now, scientists, as we know, are in general uncompromisingly objective and not given to emotion. Scientists who work with the International Panel for Climate Change, the IPCC, to review the climate research and publish the evidence which guides the global action, participated in a recent survey conducted by the UK's Guardian newspaper. They reported feeling terrified, feeling hopeless and broken, feeling that we live in the age of fools, worried about the future their children are inheriting. 77% of these scientists predicted that the global temperature will reach at least 2.5 degrees C above pre-industrial levels. 42% were convinced that it may even top 3 degrees C. Very few believe that the 1.5 degrees centigrade limit will not be exceeded. Now, as the world warms at a faster rate than at any point in recorded history, climate change is acting as a risk multiplier, impacting on health in complex ways and affecting the lives of literally everyone, everywhere. WHO estimates that 3.6 billion people already live in areas highly susceptible to climate change, and that between 2030 and 2050, it is expected to result in approximately 250,000 additional deaths per year due to undernutrition, malaria, diarrhea, and heat stress alone. And what is especially concerning is that among WHO regions, Southeast Asia has the highest estimated deaths due to climate change. Now, the impacts of the climate crisis on physical health are well recognized and include physical injury, death due to extreme weather events, heat-related illness, cardiovascular disease, respiratory illness, waterborne disease, zoonoses, and vector-borne illnesses. Now, less well recognized and discussed are impacts such as the increased prevalence and spread of infections, and an increase in antimicrobial resistance, and an increase in mental ill health and climate anxiety. Now, thankfully, the mental health impacts are receiving greater attention in recent years. In their exhaustive review published in the 2022 special issue of the International Review of Psychiatry on the Climate Crisis and Mental Health, which I had the privilege of guest editing, and Dr. Kapil mentioned it, Imperial College colleagues highlighted that given the inextricable links between physical and mental health, the myriad pathways by which climate change affects physical health are also those which affect mental health and well-being of communities. So all dimensions of climate change, including rising temperatures and sea level and extreme weather events, adversely impact mental health and emotional well-being, with socioeconomically deprived, indigenous, and other vulnerable communities being at disproportionately greater risk. Now, in terms of outcomes, the evidence on mental health suggests that high, extreme, and variable temperatures worsen a range of outcomes, including increased cases of suicidal thoughts, suicidal rates, hospital attendance, and admission for mental disorders, but also worsen population mental health and emotional well-being. In one study, an approximate 1% increase in suicide incidence has been reported for each 1 degree C temperature increase above a local ambient temperature threshold. There are worsened mental health outcomes for people living with a range of mental illnesses, and this may be at least in part attributable to the effects of some medication which impair the body's ability to regulate temperature, exacerbating the risks of heat stress in such individuals. Extreme weather events are associated with increased diagnosis of PTSD, depression, anxiety, and a number of other conditions in people of all ages. And who can doubt the anxiety linked with decisions to migrate when homes and lands become uninhabitable due, for example, to sea level rise? According to the UN High Commissioner for Refugees, millions of people are internally displaced from non-conflict disasters, the majority of which are weather-related. And even for those who are not displaced, communities with a strong emotional, cultural, and spiritual connection with their habitats and lands, such as indigenous people, are witnessing the destruction of their homes, environments, ways of life, food, water security, livelihoods, culture, identity, and belonging, and with that, their mental health and well-being. Talking about climate-related migration, I couldn't help but think that this is something I'd like to share with you, because according to the Internal Displacement Monitoring Center in India, there are currently about 14 million people who've been displaced due to climate change. If one reads about the experiences of the people of the Sundarbans Islands who are losing their homes, their entire islands and ways of life due to sea level rise, the scale of climate migration already occurring in India becomes clearer. The State of India's Environment 2022 report highlighted that India is the fourth worst hit country in the world when it comes to climate change-induced migration, with more than 3 million people forced to leave their homes in 2020-21. And estimates suggest that by 2050, India is likely to see 45 million forced from their homes. Causes that drive people from their homes range from, as I mentioned, sea level rise, repeated extreme weather events and flooding, for example, but also challenges which progress more gradually, such as prolonged drought and repeated crop failures and the consequent poverty and food insecurity. And you can imagine the impacts on physical and mental health are truly appalling. A word now about air pollution, because its links with physical health, such as cardiovascular and respiratory diseases, are better recognized. Air pollution, specifically particulate matter and nitrogen oxides, increase the risk of mental health problems too, via mechanisms of inflammation and neuronal injury. Exposure to different components of air pollution has been linked to a wide range of mental health problems, including those listed on the slide. Now, children are especially susceptible to temperature variability because they're at a stage of rapid brain development and their thermoregulation mechanisms are still immature. Evidence is growing that cold and heat exposure may have negative impacts on children's mental health and physical health and are associated with seeking urgent medical advice due to the exacerbation of anxiety and depression symptoms in children and adolescents. Heat appears to increase children's aggressive behavior and impair cognitive function, worsen academic performance, and longer term to be linked to lower literacy levels and lower earnings in adulthood. It's also the case that children and young people across the world are experiencing high levels of eco-anxiety. A 2020 survey of child psychiatrists in England highlighted that more than half, 57%, are seeing children and young people distressed about the climate crisis and the state of the environment. Another UK survey, also carried out during the pandemic, found significantly higher levels of distress among 16 to 24-year-olds for climate change than even the COVID-19 pandemic. Now, eco-anxiety is affecting reproductive choices, as one study carried out in the US has shown. Survey respondents aged 27 to 45 reported high levels of fear about their offspring struggling through a climate apocalypse and the factoring in of climate change into their reproductive choices. What is chilling is that this diagram in the 2023 IPCC report confirms that their fears are not at all exaggerated. Look at the 3 rows of people represented here, those that are born in 2020, those born in 1980 in the middle row, and 1950 in the bottom row. Note how hot and different each cohort's world will be by the time they're 70, depending on the future greenhouse gas emissions pathway we choose. The climate crisis threatens to undo the last 50 years of progress in development, global health, and poverty reduction, and to further widen existing health inequalities between and within populations. It severely jeopardizes the realization of universal health coverage in various ways, including by compounding the existing burden of disease and by exacerbating existing barriers to accessing health services, often at a time when they're most needed. Over 930 million people, around 12% of the world's population, spend at least 10% of their household budget to pay for healthcare. With the poorest people largely uninsured, health shocks and stresses already currently push around 100 million people into poverty each year, with the impacts of climate change worsening this trend. Also less well recognized are the potential tertiary impacts, such as water conflicts. These are already happening as water resources are stretched thin and communities compete for diminishing supplies. At present, these conflicts are largely within countries, but there is a risk that flare-ups between countries may occur as so many rivers and other water sources are shared. Linked to the issue of water, food insecurity and malnutrition are projected to be the biggest risk we face, with Professor Allwood of Cambridge University pointing out that in his analysis, the world may run out of food. By the end of this century, over 1 billion people living near the equator could be at risk of starvation as a result of climate change. And you can just about imagine what that may trigger in terms of greater conflicts and climate migration on a scale we've not previously witnessed. My talk would not be complete if I did not highlight the gender difference in relation to climate change impacts. It is women who take the brunt of climate change because it is women who make up the majority of the world's poor. It is those with the fewest resources who will be most susceptible to its negative effects. Kavita Ramdas, past president of the Global Fund for Women, explained it well when she said, the gender inequalities that defined women's lives prior to a climate disaster are really what put them at such greatly increased risk from climate change. How does climate affect women? Women and children are more likely to die than men during a disaster. Reasons are thought to be because women are primary caregivers and stay at home to look after the family or go in search of their dependents during a disaster. Other reasons put forward are cultural norms which prevent them from, for example, learning how to swim, which may prove fatal in a flood. In relation to food security, women make up the majority of the world's small-scale farmers, producing much of the food for the world's poor. More frequent crop failures mean that women work harder, but the family eats less. It's also the case that 80% of the world's migrants are women and children. Sexual violence is an additional trauma which women endure in addition to all the other health impacts of climate migration. Heat waves affect them more. Who cares for women in the construction industry? They do the physically hardest work. Have we ever seen a water dispenser or toilet at a construction site where women are carrying bricks and doing all the back-breaking work at 50 degrees C or even higher temperatures? Vector-borne disease carries additional risks in pregnancy, and let us consider the impact of water scarcity on menstrual hygiene and the drop in girls' attendance at school once they reach puberty. And given that it is women and girls who are responsible for household water, they're walking longer and longer distances to find safe water, reducing time for income-generating work and halving household income. However, these impacts are not distributed equally across populations globally. In a Lancet paper published in 2023, Devanayagam and colleagues included these maps. The top world map showing that over the period 1850 to 2015, countries of the global north, which represented 14% of the world's population, were nevertheless responsible for 92% of historical carbon dioxide emissions, in excess of the safe planetary boundary. The map also shows that most countries in the global south, including large populous countries such as India, Indonesia, and Nigeria, were still well within their fair share of the planetary boundary. They called this atmospheric colonization and explain that just as land and territories were colonized in the past, so too have the atmospheric commons been commandeered by wealthy countries for their own enrichment through forms of industrialization and growth that have relied on colonial patterns of appropriation with devastating consequences for all life on Earth. In contrast, the maps below show that the burden of diarrheal deaths, the risk of malaria, and deaths due to excess heat and malnutrition are all borne by the countries of the global south. There are also inequalities within countries of the global north, with the richest people responsible for disproportionate emissions. Their carbon footprint is 75 times bigger than that of counterparts from deprived communities. Although some of these inequality data have been estimated in the global north, it is likely that the same applies in relation to inequalities between the rich and poor in countries of the global south too. The wider picture is nevertheless one of racism and discrimination on a global scale, with even the Intergovernmental Panel on Climate Change in its sixth report published in 2022 naming colonialism as a historical and current driver of the climate crisis. The lack of political will to tackle the climate crisis pretty much worldwide has compelled many individuals and groups to seek justice through the legal route. A London School of Economics review of global trends in climate litigation reports that at least 230 climate cases were filed in 2023, many to seek government or corporate accountability for climate action. Significant success has been achieved in cases to challenge insufficient action by government to mitigate climate impacts. Such an example is the historic decision in 2023 made by the European Court of Human Rights, which found in favor of a group of Swiss women who claimed that weak national policies put them at greater risk of death from heat waves. The LSE report predicts that cases will continue to rise as people are becoming increasingly discontent with the lack of political will to address climate change. I feel proud of the significant role the Indian judiciary has played in advancing climate action and environmental governance and environmental jurisprudence, often ruling in favor of the human rights of vulnerable people, for example, forest dwellers. And most recently, the Supreme Court of India delivered a historic judgment on climate change and human rights in M.K. Ranjit Singh and others versus Union of India and others on March 21st, 2024, when the Supreme Court formulated a new constitutional right to be free from the adverse effects of climate change by drawing upon the fundamental right to life and personal liberty and the fundamental right to equality of the Indian Constitution. This sets a precedent for the whole world. Now, moving swiftly on to research, it remains challenging, though, to accurately estimate the scale and impact of many climate-sensitive health risks. That said, scientific advances have facilitated greater attribution of increases in mortality and morbidity to global warming and more accurately determining the risks and scale of these health threats in recent years. But modeling challenges persist, especially around capturing risks like drought and migration pressures. There are so many aspects which deserve better evidence generation, such as gender inequality, the socioeconomic climate health links, the positive impacts of climate mitigation on health and the economy, and the list goes on. And there's also the need for more stories and case studies. These are providing increasingly more powerful evidence to policymakers when numbers are inadequate. There is significant inequality and injustice in public health research funding and a power imbalance between those with voice and those without. My study within the UK, and you can see the BMJ cover page right at the top right-hand side, demonstrated inequality in the context of health research, even within the UK. And other UK academics have confirmed that this is so on a variety of climate-linked subjects on the global stage, in funding, for example, for climate and energy, transport, and decarbonization research. And you can see the imbalance in their global map and pie chart. It is highly unlikely that the situation will be different in terms of research into the health impacts of climate change. So the research aspirations of indigenous communities and countries of the global south, most at risk of climate change, remains a distant prospect. I hope that the Prasanna School of Public Health will be a strong voice in challenging this imbalance and helping create greater opportunity for climate and health research and justice, and bring that justice to the most vulnerable populations in the global south, starting in India. So, in conclusion, schools of public health, such as Prasanna, have a crucially important responsibility for evidence generation, training and education, and supporting policy development on climate change and health. I hope Prasanna School of Public Health takes up that role with energy and ambition. We're here to support you in this vital endeavor. I thank you so much for listening.
Thank you, Professor Rao. That was really a wonderful, very insightful, concise, and inspirational presentation, really. And I think some of the key points that you have made will be a great segue to Dr. Khemka's talk, which is going to focus on the specific issues and impacts related to cities and our urban environments. As you all know, urbanization continues to progress rapidly around the world in many countries, in most countries actually, including in low and middle income countries. And the special impacts on cities and urban populations and communities are going to be the focus of Dr. Khemka's talk. I think you've done a wonderful job sort of laying out the special and significant impacts of climate on health in the Siro region specifically, and in many other countries around the world. The neglected areas such as women and children's health, the impact on health systems, and very importantly on mental health. And I think the issues that you have raised around research gaps and the need for generating evidence and the key role of schools of public health in generating that type of evidence moving forward are really very important points. And hopefully we'll come back to some of those during the Q&A session. So let me at this time turn it over to Dr. Nitya Khemka for her presentation, which is going to focus on cities at the crossroads where climate, health, and equity converge. And I think you will all see how these presentations will really link together and hopefully generate some very interesting discussion in the amount of time that we have left. So Dr. Khemka, back over to you.
So good afternoon. It's such an honor and privilege and to share the stage, as it were, with such stalwarts in public health, Professor Mala Rao, Professor Vikas Kapil, the entire School of Prasanna Public Health, and also special thanks to the Prasanna School for this huge opportunity to be with you today. My talk is going to be focusing on the challenges of urbanization, as Professor Kapil said, urbanization, climate, and health. So urban growth rates and climate vulnerability indices reveal very critical trends in global development. The global south faces significant urban health and climate challenges that are increased by rapid urbanization. By 2050, as the slide says, cities in the global south are projected to absorb nearly 96% of a global urban population increase, and India, China, and Nigeria could account for nearly 35% of this total increase. So huge numbers here. And as you know, urban areas are increasingly vulnerable to climate change due to dense populations, but also the infrastructural challenges. And these insights underline the importance of integrating climate considerations into urban planning. Now, the climate crisis, as Professor Rao said, is manifesting in various forms across the globe already, and particularly in rapidly urbanizing settings. So recent extreme weather events have highlighted this growing impact of climate change across the globe. And on this slide, you can see on the right-hand side, the Indian heat wave that Professor Rao referred to. Severe heat wave swept India last year, with some regions recording temperatures as high as 50 degrees. And this was during the elections, if you remember. So it affected, voter turnout and lots of heat stroke fatalities amongst officials and citizens. And of course, similar heat conditions were reported in several Asian countries. Now, the picture on your left is from the recent flood in Pakistan in the summer of 2022, which, as you remember, were also very dramatic and detrimental. Pakistan is among the top 10 most climate-stressed countries, and 33 million people were affected by the floods. 6.4 million needed humanitarian assistance. 1.4 million houses were damaged or destroyed. So the magnitude of the numbers are just mind-boggling. Several such other examples. There was a tornado recently in the South China Sea, flash floods in Kenya, and of course, who can forget the searing images of the fires in Los Angeles that are flooding our TV screens now. So there are various indices that give us an idea of where climate change will be felt in urban areas and beyond. And one such is the Global Climate Risk Index, which analyzes and ranks to what extent countries and regions have been affected by impacts of weather-related loss events, such as storms, heat waves, etc. Apologies for this map. It's not precise, but this comes from a secondary source. But in the last 2 decades, between 2000 and 2020, Puerto Rico, Myanmar, and Haiti were the most affected by extreme weather. Over 500 million people have died as a result of 11,000 direct extreme weather events globally, and huge losses of roughly 2.56 trillion US dollars. And again, sadly, low-income countries are particularly affected. 8 out of 10 of the most vulnerable countries are in the low and middle income categories. Here's a slide that's looking at food insecurity and climate change. As Professor Rao said, climate change will also affect the food supply in the most food insecure countries. And on this map, we see that the percent figure represents the percentage of population undernourished. The bigger and darker the figure, the larger the undernourished population. And the color of the country is the Hunger and Climate Vulnerability Index. So the darker the color, the higher the vulnerability. And you can see that many of the countries most vulnerable to hunger and climate change are also the ones with the highest percentage of undernourishment in their current populations. So this really reflects how climate will amplify existing food insecurities. And finally, the countries most vulnerable to climate change contribute the least to it. And in this graphic, we see that the high-income countries are in blue, the middle income in yellow, and the low income in red. And the bigger the circle, really, the higher the amount of historical emissions. And you can see that the high-income countries contribute the most to climate change, but are the least vulnerable to it. So we can see how health, climate change, and equity are deeply intertwined with influencing each other. Health equity is really when every person has the opportunity to be as healthy as possible, and no one is disadvantaged from achieving this potential because of social position or socially determined conditions. Climate change, of course, exacerbates health inequities, while health disparities can hinder effective climate action or adaptation to climate. And this is this mutually reinforcing circle. And also populations often contribute least to greenhouse gas emissions suffer the most from health effects, and therefore it's very important to have policies that prioritize investments in to vulnerable communities in order to reduce climate impacts. So I'll talk a little bit now about the different ways in which climate change plays out in the urban areas and how this affects health, namely extreme heat, air pollution, and water-related challenges. Of course, there are very other critical challenges of food security and infrastructure, but I'm not going to dwell on it in this presentation. So heat-related mortality in the urban context is a significant public health concern, particularly affecting vulnerable populations such as the elderly, children, and people with pre-existing health conditions, and of course, low-income groups. The burden of heat-related mortality is not evenly distributed. Asia accounts for over 45% of the 500,000 annual global heat-related deaths. But of course, high-income countries are not immune to extreme heat. In the summer of 22, you'd remember Europe was very badly affected with nearly 62,000 heat-related excess deaths. And the WHO emphasizes that heat is a leading cause of mortality and can significantly impact mental health, as Professor Rao highlighted in her seminar. Moving on to air quality, poor air quality, we know this in living in India. It's another issue that's linked both to climate change as well as rapid urbanization. In densely populated area with poor transport infrastructure and regulation, vehicle fumes have a detrimental effect on air quality and exacerbate climate change. And climate change in return and the hotter temperatures caused by it can worsen air pollution in cities. And again, it is not, air pollution is not uniformly distributed across populations. Individuals from lower socioeconomic groups are more likely to live in areas with higher pollution levels. And I was seeing a study about how this was correlated to greater violence as well, particularly in inner cities. And a global analysis indicated that approximately 7.3 billion people are exposed to unsafe average annual PM 2.5 concentrations, with 80% residing in low and middle income countries. And amongst this, nearly 716 million people living on less than $2 a day. So you can see very clearly the high levels of inequity in this situation. And so closer home, I wanted to talk about Bangalore because I think it demonstrates the interaction between climate change, population density, and air quality very well. Bangalore is known for its moderate climate, but it's experienced significant temperature changes due to rapid urbanization and environmental factors. And studies have indicated that Bangalore's average temperatures have risen by 1.5 to 2 degrees over recent decades, with notable increases in maximum and minimum winter temperatures from December to April. And Bangalore's heat island effect shows urban areas are warming much faster, with land surface temperatures rising by 0.34 degrees annually compared to 0.14 degrees C in the less developed areas. And Bangalore faces significant challenges regarding air quality due to the rapid urbanization, to the vehicular emissions, as well as the industrial activities. And AQI you'll know this better than many of us, can exceed 150 during peak pollution days, particularly worrying for sensitive groups. So we've looked at heat and air pollution, and now I want to turn to water briefly. Flooding incidents also have been on the rise recently due to climate change, rapid urbanization, as well as insufficient drainage infrastructure. According to a study, nearly 500 million people living in poverty face high flood risk. And again, sadly, there have been numerous examples of recent flooding events. We saw in India in 2024, the heavy rainfall in Wayanad in Andhra Pradesh, creating flooding and landslides. In the US, the flash floods in Missouri last year, and then who can forget those searing images of Spain, Valencia last year, which led to severe flooding and caused significant economic disruption and prompted a national emergency response. But the other side to flooding is, other side of the coin is water scarcity. And water scarcity and quality issues are critical global challenges that affect millions of people, particularly in developing countries. And the causes of water scarcity can be tend to be interlinked, whether it's increased demand, whether it's inefficient water management or groundwater depletion. And they're all linked to a changing climate, which affects both the quantity as well as the quality of available resources. And again, just briefly to talk about the health implications of water-related challenges. I'm not going to be talking about all of it, but key health implications include waterborne diseases, because flooding can lead to contamination of drinking water, increasing the risk of waterborne diseases such as cholera, dysentery, typhoid, and then, of course, inadequate sanitation facilities, which exacerbate the risks. There's also the risk of disruption of healthcare services, because flooding can damage and disrupt medical services. And then, of course, the hugely important nutritional challenges, because flooding can destroy crops, disrupt food supply chains, and lead to food shortages, but also increase malnutrition rates in affected communities. And this is particularly, I think, concerning for low-income communities that rely on local agriculture. I wanted to talk briefly about a case study of Chennai, which, as you know, has faced severe water crisis in recent years, culminating in a notable event in 2019, referred to as Day Zero, when the city nearly ran out of water. And prolonged drought and poor rainfall due to climate change reduced major reservoirs to less than 1% of its capacity. As a background, we've had huge population growth. Chennai is home to 11 million residents. There's been rapid urbanization and the population growth, which has increased the demand for water. But then also there is a dependence on rainfall, because the city primarily relies on monsoon rains for its water supplies. And erratic rainfall patterns have exacerbated water scarcity issues. And this has led to severe impacts, both in terms of health risks. I've talked about the heightening waterborne disease risks, but also economic consequences, including the costs of higher costs for private water supply and social tensions, because competition for limited water resources has sparked social conflicts, especially in poorer neighborhoods with unreliable access. So we've touched briefly on heat equity earlier, on health equity earlier, but I wanted to talk a little bit about climate vulnerability now. So in this picture, we see a picture of Bangladesh, actually Dhaka, that was flooded after a rain event. Bangladesh is, as you know, one of the most vulnerable countries in the world to climate change, and millions of people live on very low-lying land just above the sea level, high rates of poverty and unstable infrastructure, some of the reasons why it is so vulnerable. So climate vulnerability, according to the CDC definition, is the propensity to be adversely affected And vulnerability encompasses a variety of concepts and elements, including sensitivity or susceptibility to harm and a lack of capacity to cope. Just to say that I think it's important to examine what constitutes vulnerability and to think about what the various dimensions that contribute to vulnerability is. And I'd like to turn to the socio-ecological model. And this on the next slide is from the Yale School of Public Health. And I found it very useful to think through the various determinants that affect vulnerability. So the first concentric circle is the individual level, which identifies the biological and personal history factors that increase the likelihood of someone being vulnerable. And this could be age, education, or income. The next level, or the second concentric circle, is around relationships. So what are the person's closest social circles like? What are the peers? What is the relations with the family members? Who are the people who influence their behaviors and contribute to their experience? Now, the third level is a community, such as schools, workplace, and neighborhoods in which the social relationships occur. And then finally, the fourth level is the societal level, the broader societal factors. These can include the social and cultural norms. It could include health, economic, educational, social policies that maintain equality in society. And this is the socio-ecological model as it relates to heat-related morbidity and mortality as an example, because it overlays how vulnerability can be compounded by various factors that influence a person's life. So at the individual level, at the bottom, we can see we have age and health status. So some components that influence a person's susceptibility to heat include asthma, obesity, cardiovascular diseases, diabetes, and also income. The next level is the relationship level, and this includes aspect of the home and immediate social environment that can increase or decrease their likelihood of getting a heat-related illness. And this includes things like access to cooling, what the socioeconomic situation is like, what the type of home is like. Is it a kacha home? Is it a pakka home? The next level is the neighborhood or the community, which is looking at local social factors that may influence somebody's susceptibility to heat, including access to green space, something called pervious pavement, which is not very relevant to India, but also access to greenery and tree canopies, etc. And then finally, you have the meso and the global level, largely to do with regulation and policy. So there are three categories of vulnerable people. I wanted to talk about migrants, urban poor and informal settlers, and elderly and children. But because of the paucity of time, I'm going to be skipping over these slides. And then I want us to spend a few moments talking about the policy and action framework. So the global policy landscape, as you know, is increasingly acknowledging the links between climate change and health, especially in urban settings. I was at COP last year, and the COP29 presidency, in collaboration with UN Habitat, introduced actually a 10-point plan to strengthen cities' roles in climate decision-making, emphasizing multi-level action in urban climate finance. And additionally, there was the launch of something called the Coalition for High Ambition Multi-Level Partnerships, also called CHAMP, which supports local leaders in preparing the nationally determined contributions of the NDCs, backed by over 60 governments to strengthen financial mechanisms and address vulnerability from the local level. Health systems preparedness emerged at COP as a secondary but a critical theme, with COP29 emphasizing the integration of public health within urban climate strategies. And on the finance front, sadly, finance is always the elephant in the room, and the discussions revealed a significant gap, with less than 1/3 global climate finance actually going towards adaptation and only 10% reaching local levels. And of this climate adaptation funds, only 0.5% actually go into health adaptation. And to address this, COP29 announced new partnerships aimed at mobilizing investments for urban climate initiatives, including commitments to support sustainable building practices and waste management systems essential for reducing urban carbon footprints. India is actually a good example of a country that has ramped up its efforts to make its cities more climate resilient. Of course, it's work in progress, but I really do think that India's policy frameworks for urban climate action, health systems preparedness, and finance mechanisms adopt a comprehensive approach to tackle climate change and public health challenges. The Climate Smart Cities Assessment Framework, or the CSCAF, launched by the Ministry of Housing and Urban Affairs, helps cities address or assess climate resilience through many indicators. There are 28 indicators in 5 thematic areas like energy and urban planning, etc. And there are also the city climate action plans, which are developed using the CSCAF to integrate mitigation and adaptation strategies into urban development, creating a vision for climate resilient cities. And then with health, of course, there are schemes like Ayushman Bharat, which really enhance healthcare access for economically disadvantaged populations, putting the last mile front and center when we talk about health equity and access. And of course, we have PPPs that are fostering innovation in healthcare delivery and digital health solutions, for which India is emerging as a leader. So, how can countries protect their health of their urban populations while taking everything into account that we've discussed regarding equity and vulnerability? I think equities focused solutions are key, and particularly to ensure that vulnerable populations are not left behind. And this includes, I want to touch upon 4 brief pillars. The first is around inclusive urban planning approaches. Things like participatory planning, equity in land use, such as zoning for affordable housing, and green spaces to reduce gentrification and displacement, as well as integrated services to create cohesive neighborhoods that are accessible to all residents. There's now a concept of a 15-minute city where most daily services such as work, shopping, leisure, healthcare, education can easily be reached by a 15-minute walk, bike, or public transit ride, which is what we should be moving to reduce our carbon footprint. The next pillar is around climate resilient infrastructure. The OECD actually estimates that $6.9 trillion annually is needed by 2030 for climate resilient infrastructure to meet the SDGs. And this means that we really need more innovative funding mechanisms. There's also nature-based solutions like green roofs in urban forests and permeable pavements with lower upfront costs than traditional infrastructure, and this helps to boost resilience. And then the third pillar is around social protection measures, including safety nets for vulnerable populations, but also job creations through green initiatives and education and training in green technologies to really empower communities to engage in effective climate action. And finally, healthcare access improvements, strengthening health systems, expanding UHC. Professor Rao talked about expanding UHC and the community-based health initiatives that can really improve access to preventative care and climate related health education. And then, of course, we know what to do, but why aren't we doing it? And again, sadly, we know that the problems are around resources, around human resource shortages, particularly institutional capacity, weak governance, and limited capacity to implement, coordination needs, which is fragmented efforts, and the need for a multi-stakeholder coordination and the challenges that come for that. And finally, what's really missing is there are huge data gaps, as Professor Rao said, and also the lack of robust monitoring systems. So just to conclude, I think since the first COP, narratives and governance structures have shifted significantly. It's become much more commonplace to explore the interlinkages between climate, nature, and health. And designing equity considerations to climate and health interventions has now also become very much established as a standard of good practice. However, I think this progress shouldn't disguise the fact that the world is falling short of all of its climate targets. Hundreds of thousands of people are already suffering under the health implications every year. And as we sadly last year, we reached the 1.5 degree mark of global heating that the Paris Agreement set out to avoid. It's probably a blip due to El Nino, but very unfortunately, looks like we're already there. And one of the biggest barriers, I think, is the funding, especially for cities in low-income contexts that have contributed the least to the climate crisis. One hope spot is the Green Cities Initiative by the European Bank for Reconstruction and Development, which shows that multilateral development banks could actually funnel more funding directly to cities. And I think that if we're truly to see transformational changes in cities, we need much more large-scale funding for low-carbon, climate-resilient infrastructure projects, in addition to ramped up national funding for urban development projects. Now, the second bucket is around closer collaboration, particularly between environmental health and health departments, but also the finance departments. While it's becoming more common, it's still a rarity. Health promoters advocate for healthy diets without considering the environmental footprints, and cities' carbon emissions are being reduced without looking at the urban design's impact on health and well-being. So bringing health and climate closer on the global level is a first step which needs to be replicated on the regional, the national, as well as the local levels. And finally, we're seeing again and again that the big structural projects are most successful if they're designed together with the communities that will be most affected by them. And programs that reduced car use in the city centers of London, a city that I live, and Paris encountered wildly differing responses from their local populations. And these responses really depended largely on the extent to which communities felt consulted and to which their needs were integrated into the program designs. So involving people most affected by the plans in the planning process is very key to truly equitable approaches to the crossroads between climate and health. Thank you once again for your time and listening to me and for this opportunity.
Dr. Khemka, thank you so much for a wonderful presentation. Your remarks, I think, aligned so nicely and in such a complementary way with Dr. Rao's remarks as well. I just think it's a remarkable set of presentations today, and I love the emphasis and focus on health equity in your remarks, Dr. Khemka, both at an individual level for people, but also tying into the earlier remarks from Dr. Mala about the sort of global inequities that we're facing in the world of climate change and health. Dr. Cherian, with your permission, I know we're at time, but I thought maybe if we could just extend about 5 minutes. I did want to just make a couple of remarks, and there are some very interesting questions. Maybe we could pose one question to each of the speakers. First of all, I wanted to mention a very important comment. It's really more of a comment rather than a question from Professor Rajasekharan Nair in the chat. And he just mentions that some of the areas that have been discussed today, such as migration, the mental health impacts, and so on, are in dire need of more hard evidence to sort of, I think, address some of the skepticism in some circles. So I think that's a very important point. I think Professor Rao touched on this, that we need to build this body of evidence, and that how important schools of public health role is in doing so. So let me pose the first question to you, Professor Rao, and then I do have one for Dr. Khemka as well. And really, either of you should feel free to respond to either of these questions. But in follow-up to this comment, there is a lot of concern about a lot of disinformation and misinformation around climate change in general, and specifically in the area of climate change and health. We've seen this in many other areas in public health recently. We've seen it with COVID. We've seen it with vaccines. Could you say a few words? And I know that this whole issue of evidence is relevant for this discussion as well, but could you say a few words from your perspective on what we can do in the global health community, in the public health community, to address these issues related to misinformation and disinformation among the public, even among some scientists? We certainly have this issue here in the United States. I know you face this in Europe as well. So I'd love to hear your thoughts on this, on how do we communicate differently or better to address these challenges?
Thank you. Actually, it's a crucially important question. I'm so grateful to you for asking it and allowing us to reflect on that with this distinguished audience. I think there are. I see this as I segment it into three different problems or challenges. The first thing is there are areas where information or data and evidence is lacking. So migration is one of them. Nitya picked that up about some of the things where it's lacking. That's one. And of course, our policymakers tend to say, well, prove it. If you can't prove it, then I'm not going to put funding towards it. I'm not going to invest in it. So we do have an obligation to collect the data and demonstrate what's happening. And in that regard, I'm so pleased that qualitative evidence is beginning to be collected much more formally, methodically, systematically, so that it provides that powerful, complementarity to numerical data, where numerical data might be difficult to establish. That said, I was giving a talk to the Indian Association of the Study of Population in India. We have some of the best statisticians in India and in the global south, and they are given resources perfectly able to collect the information. And of course, with attribution science, by and large, and modeling and all these sorts of things becoming so much more accurate, our capacity is there. It's about channeling funding to the right places, building that capacity, and making sure we have that evidence, quantitative and qualitative, because that backs what we need. The second group are those who don't have the evidence. There's so much ignorance. So you talked about disinformation and misinformation. There are the uninformed as well. And my own friends, doctors, who say, well, is it really as bad as all that? That kind of question. And you think, what bit of this existential crisis do you not understand? But genuinely, people don't get it. And so we do have an obligation as health professionals with an interest in this to work with WHO, schools of public health across the world, to think about how do we systematically ensure that information in digestible ways, penetrates all parts of society, and in a way that they know how to make changes in their own lives and in their spheres of influence to help with the climate action. And the third is the kind of climate deniers, the misinformation, and even WHO. I was very interested to see they've now put out a correcting misinformation channel. WHO never had that before. And yet they do now. There's that much anxiety about deliberate fakery and misinformation that's out there in the social media, which we can't block. And we do have to find a way by which counter that. And unfortunately, I guess the only way around that is to get as savvy on social media and ways by which young people in particular gain their information, to penetrate those sources of information with correct information and to present it in non-threatening ways, so that people actually recognize that this is the genuine information they need to they need to follow. And I think building on the forest fires, I mean, in the US, look at the amount of misinformation even political leaders are disseminating on the causes. Of course, the thing is, infrastructures and so on do contribute to it. So there are many infrastructural issues which contribute to disasters, as Nitya was rightly pointing out. It's an interplay, a complex interplay of poverty, systems, the environment we have, and climate. But these are things that we have to counter. We have to do this calmly and in a systematic and an evidence-based way, and keep doing it. Because I think a one-off lecture, a one-off talk to an audience is not going to be good enough. We have to recognize this is almost our biggest responsibility now, to ensure the appropriate information gets to all parts of society. Sorry, long answer, but I do feel very, very
excellent.
exercised by it.
Excellent summary. Dr. Nitya, I would invite you to also feel free to jump in on this question. I know I certainly have thoughts on this as well, but I wanted to pose a related but slightly different question to you about the role of the private sector. You talked about the importance of communities and in engaging civil society. The private sector also plays an important role in addressing climate change and health impacts in cities. Are you aware of any successful examples from the US, from UK, India, Europe, or any other countries that demonstrate the role of the involvement of the private sector and how that can be useful or helpful? And certainly there may be a role for the private sector in this whole issue of communication that we were just discussing as well. So please, if you have any thoughts on the private sector or this issue of communication.
Thanks, Dr. Kapil. And I just want to add my two bits to Professor Rao, who covered the whole spectrum, but I feel also very strongly about this misinformation. Absolutely right. Firstly, we need to move away from evidence informed to, rather than evidence based, also to evidence informed, where we take much more qualitative data into consideration. Secondly, I think as health professionals, communication is very key, and it's almost like we need to know thy audience. Who are we communicating it to? Yale School had a wonderful study where they looked at 6 Americas. There's a different audience, concerned, there is doubtful, engaged, alarmed, concerned, cautious, and dismissive. So we need to, as health professionals, we need to be able to tailor our messaging to these diverse audiences. And also, finally, we need to make, as Professor Rao said, we need to make that link between extreme weather events and climate more clearly, which unfortunately is not happening, even in the case of the Californian fires. We're talking about water from the Pacific and fish in the Pacific, but not making that very direct link. And moving on to the private sector, absolutely right. I think that's a great question. And I think private sector, not only can the private sector bring resources into the game, as you know, the adaptation funding, seriously, there's a huge gap, but also that they can bring their innovation and their efficiency in producing the solutions when it comes to moving the needle on climate change adaptation. And in terms of examples, I think 2 great examples that come to mind is Microsoft actually has used AI to map for an urban heat mapping project in Miami, Florida, where they use smart technology to find the hottest parts of the city. So think of it as a temperature map that shows what neighborhoods need the most help and what neighborhoods need greater emergency services, and particularly during heat waves. So they used AI to map this, and they spent nearly $150 million doing this, but they've got this whole heat vulnerability map of Miami, and now they're sharing it with other cities across the globe. And then also very interestingly, from Denmark, the Copenhagen Infrastructure Partners, it's a Danish company that's come up with a very smart way to pay for flood protection through innovative financial instruments. And instead of just relying on government money, they got private sector capital, private investors to fund projects in particularly sensitive areas. And these investors make money because the protected areas have lower insurance costs, but also higher property values. And this has worked so well that many other cities in Europe, as well as Asia, are copying it. So lots of really great examples from across the globe. Thank you.
Well, thank you both so much. I'm afraid we're going to have to wrap up today because we are out of time. We're actually over time. We had nearly 50 participants online. There were a lot of other great questions, and I'm sorry we won't be able to get to those, but I feel like we could continue on for another hour. I've learned so much from both of you, and I can't tell you how thankful we are for you all joining us in these presentations. Dr. Cherian, thank you to you, to Dr. Rahul, Dr. Vani, the entire team there at MAHE, and of course, thank you to the Endowment and to the Prasannas for their support in making this lecture series possible. I think you can all appreciate and the enormity of the questions and the problem, and why bringing these disciplines and the speakers and the community together around these issues is so important, and why this type of series can be so impactful, hopefully in addressing some of these concerns around the lack of evidence and the need for communication and so on climate and health. I really look forward, hopefully, to meeting both Dr. Mala and Dr. Nitya, both of you in person sometimes, either in Europe, in the United States, or in India. So hopefully we will have an opportunity to do that. Dr. Cherian, any closing remarks? And if not, I think we can close for today, but please, back over to you. Thank you so much.
Thank you very much. I think that was an excellent treat. I was just looking at the World Economic Forum forecast for 2 years and 5 years. It is very interesting. For 2 years, the first is disinformation and misinformation, and second is extreme weather events. For the next 10 years, it is extreme weather events. I think so. We rightfully covered that, and it was a real feast to listen to you. And thank you, Dr. Kapil, for excellent moderation. We'll try and sort of curate those questions and try and see how best we can respond to them. Usually, we share the recording, which is a big support for many of the academics. And when we're taking the challenges that School of Public Health has to take on, so we hope we live up to that with your support. Thank you very much. Thank you, everyone, and have a nice weekend.
Thank you.
Thank you very much.
Bye-bye.
Bye-bye.
Thank you.
Very nice to
Bye-bye.
meet you. Thank you.
Thank you.
Bye-bye.
Bye.